Hello everyone, welcome to my YouTube channel. We are going to be looking at some results, scenarios that I think someone did send this to me, so I thought I should answer the question so that it can benefit everyone. But before we continue, my name is Dr. Emmanuel Obodo. I'm a biomedical scientist and I'm also a lecturer in biomedical science here in the United Kingdom. So what we are going to be looking at has to do with race Aptt scenarios. Obviously, I have videos regarding race Aptt, but I think this will also be beneficial. Okay, so right, let's get into this. Now, there is a question on race Aptt. So obviously there's a result, and this person was asked, what would you do next? I want you to note the word, what would you do next if you came across this result below for a coagulation screen rather. Please outline two possible scenarios and their associated tests you would carry out in both scenarios. Now, this question a lot is involved in that one question. So, and that is why I thought maybe I should make this video. Okay, now let's go again. So forget about the result for now. He's saying, what will you do next? That's the first thing. Okay, what to do next. The second thing is, that's what you do next when you come across this result. So next, what you are going to do next when you see this result. Two, then outline the two possible scenarios that these results is presented to you. Then mention the kind of any associated test you may carry out in those both scenarios. So first of all, let's look at the results. Then we can now talk about what we can do next. We can look at the possible scenarios, okay? Then we need to look at the possible tests that may be associated with this. I'm going to try to answer this question quickly. So if you look at this, looking at the reference ranges, obviously you see that the only thing that is raised here is Aptt. So prothrombin is fine, fibrinogen is fine. And like I had already mentioned to you guys on my previous videos, you will see that what this means is that extrinsic pathway is okay. Common pathway appear okay as well, okay? But intrinsic pathway, perhaps something is happening there, okay? So it will be important to start that way of mentioning the fact that Aptt measures intrinsic pathways, okay? Right. So now, what would you do next? Now, I want us to quickly think about pre-analytical, okay? Even though, if you look at these results, the Aptt is raised, perhaps you might need to consider the pre-analytical. Like, is the sample clotted? Is the sample underfilled? I know you may not want to think this way because of because of PT is normal, fibrinogen is normal, but there is nothing wrong mentioning the possibility of underfilled samples, the possibility of clotted samples leading to raise Aptt. Does that make sense? Right. So that's what you might need to consider to check the pre-analytical phase of this patient result. Okay? Now, I've mentioned that. Another thing we might need to do next is to investigate, is this patient on any anticoagulant? Perhaps something like heparin. Okay? So I'm telling you what you need to think about. So we've checked we have to check the pre-analytical. Is it underfilled? In fact, is it hemolyzed? Is it lipemic? Like I've taught you guys before about HEAL test. Hemolysis, hysteresis, that's high bilirubin, and lipemic. So is it hemolyzed? Is it high bilirubin? Is it lipemic? Is it underfilled? Is it clotted? So these are what you might need to check pre-analytically. Then another thing we need to check, like I've mentioned, is this patient on any anticoagulant? Like I said, maybe heparin. Okay, so these are what you need to do next. Okay, you consider that next, right? Now, because you have considered this, it then means that any of this possibility could have contributed to that. Okay, right? Obviously, if there is any problem with the pre-analytical, like we have mentioned, either hemolysis or lipemic or hysteris or underfilled or clotted, of course, we might need to reject the sample and ask for a repeat. Okay, right? But I don't think that is what they are asking here. However, it is important that you also mention the pre-analytical check. Okay, right? I think what they want to see here are the scenarios, such as maybe number one scenarios. We could look at perhaps this patient is on anticoagulant, or if this patient is not on anticoagulant, maybe this patient may have factor deficiency. Okay, right? So now I just decided to put these two scenarios together for you. So number one, the possibility why this Aptt is high could be that this patient, apart from what I've mentioned in terms of pre-analytical, or the patient is on anticoagulant. Okay, so if the patient is on anticoagulant, it explains the result. Okay, if it is underfilled, it explains the result. If it is clotted, any of those things I have mentioned, it explains the result. Then you might have to, if the patient is on heparin, of course, that explains why it is high. Okay, because this will measure the dosage effect of that very heparin, right? The two possible scenarios here I would want you to think is, one, is the patient on heparin or anticoagulant? If not, is it possible that this patient has factor deficiency or inhibitors? That's the two scenarios. One, is the patient on anticoagulant? Two, is it a factor deficiency or is it an inhibitor? That's the two scenarios here. Okay, now, what are the associated tests that you might need to do to investigate this? Remember, I'm trying to answer this question. Okay, I'd already told you guys in my previous video what you need to do, all of that. So I just want to stick with that. So we have looked at what to do next, the pre-analytical. Dash, check the samples, check the patient condition, check the patient history. Is the patient on anticoagulant? If yes, that explains it. But what I want us to see here, if the patient is not on anticoagulant, it could be that is a factor deficiency, or it could be that it is an inhibitor. So the first thing to check now is the patient on anticoagulant? That's the first scenario. That could explain the result. Okay. Second thing is that if the patient is not on anticoagulant, perhaps it's a factor deficiency or an inhibitor. That is the second scenario. Now, let us begin to answer the last question. The last question says, and their associated tests you would carry out in both scenarios. So the first scenario is that the patient is on anticoagulant. The second scenario is that the patient is not on anticoagulant. So the patient is on anticoagulant. That explains the result. The patient is not on anticoagulant. Therefore, we are suspecting factor deficiency or inhibitor. Now, let's stick with the first one first. The patient is on anticoagulant, maybe like heparin. Okay. So what will be associated tests you are likely to do? I tell you quickly, what you are likely to do is anti-factor 10A, anti-factor 10A, anti-factor 10A. That is what you need to investigate. So once in the lab, once you have raised Aptt, okay, if the person is on anticoagulant like heparin, okay, once you do the anti-factor 10A, is going to be high. So the high result of anti-factor 10A will confirm that this patient is on heparin. Okay, so high level of anti-factor 10A will confirm that this patient is on anticoagulant such as heparin. So that is just to stick with the question that have been asked here. So that's the first scenario. The second scenario now is that we are considering, is it a factor deficiency or an inhibitor? And like I had said on my previous videos, then in that scenario, we now need to do mixing studies. Okay, so that mixing study, okay, will involve getting a control sample and the patient sample, mixing it together and repeating the APTT. Okay, so we'll do mixing study, okay, which is PT50. Then obviously, if the results correct, like if the APTT become normal, that means it's a factor deficiency, because like I had said on my previous video, what it means is that the factors in the control sample has compensated the insufficiency of the factors in the patient sample. So once the result come back to normal, meaning is corrected, that is a confirmation of what? Factor deficiency. However, if it does not correct, is a confirmation of what? Inhibitor. And like I had said, that means there is some things inhibiting the patient sample's clotting cascade and that of the control sample. Okay, right. So the second scenario is to measure mixing study, which can help us to determine whether the patient has a factor deficiency or an inhibitor. Okay, whereby is a factor deficiency, we can carry out a further test to do factor assay. On this occasion, intrinsic factor assay. Okay, assays. Okay, right. If at the end it did not correct and we suspect inhibitors, we may consider something like lupus anticoagulant, thrombophilia, as the case may be. Okay, so that is the associated test in both scenarios. So the scenario one, the patient is on anticoagulant. We can confirm this doing factor anti-10A, okay, assay, okay, factor anti-10A. Or the second scenario, the person is not on anticoagulant, suggesting factor deficiency or inhibitor. If it corrects, when we do mix, then we have to do mixing study. If it corrects, it suggests factor deficiency, okay. If it doesn't correct, it suggests inhibitor. In factor deficiency, we do factor assay. In inhibitor, we do lupus anticoagulant or we do thrombophilia. Does that make sense? Okay, right. So these are the two things you are going to see there. Okay, obviously, like I mentioned on my previous video, in a case of factor deficiency, what are we going to use? We might need to use something like fresh frozen plasma. Okay, right. So that is what happened here. I hope that makes sense. Okay, if that makes sense, I will say thank you very much for listening. I don't know if you have any question. Feel free to put it on the comment section. Let me know what you think. You know, I'm more than happy. If you have any other question, do put it there. Obviously, I know I'm busy, but if I have time, I'll definitely answer it for you. All right, thank you very much. Till I come back your way again, please like, share, subscribe. I wish you all the best. Bye-bye.